Right, it is 7 o'clock, and we are ready to get started with tonight's Pathways to the Medical Profession at UC Merced. Well, welcome all future Bobcats, family, and guests. We have 1 hour this evening to learn a little bit more about the pathways to medical profession. We hope to do the PowerPoint presentation in about 20 minutes or less, so we can leave plenty of time for our question and answers. Joining us this evening is Dr. Margot Vanier. She is a medical doctor and family physician. She's also leading up the program for the medical education program and the opening of our medical building. Dr. Maria Ramirez, she is with health psychology. Dr. Susanna Ramirez, she is from public health. And Dr. Heather Bortfeldt with the developmental psychology. To kick us off this evening will be Dr. Vanier to start the presentation.
Hi, welcome future Bobcats. I am very excited to meet you in person, and this is just a poor approximation online, but hopefully I will get to see everyone in person on campus soon. My name is Dr. Margot Venner. I'm a family doctor, um, and I am here to talk to you tonight about why UC Merced is really not just the ideal place, the best place to have a career in pre-health. And I think there's a lot of reasons for that. We're going to explain them today. But I want to start by just saying that you have so many opportunities in front of you. This is a really miraculous moment. You've worked hard to get you here, and we want to help you get to where you want to be. And if that's a healthcare career, we want to help you get to where that should be. But there's also a lot to explore. And so tonight we're going to talk a little bit about why you see Merced. So could I have the next slide, please? So the first thing to know is that there are a lot of healthcare professionals. It's not all about being a doctor. As you can see here, I started making this slide and I just put down a few, and I had to stop myself when PowerPoint wasn't letting me readily put more squares that you could still see easily from your screen on here. The number of different types of healthcare professions is huge. The number of types of different doctors is enormous. Everything from a medical doctor like me, I'm an MD, I'm a family doctor. I work in the refugee clinic, which is where I've actually worked for my entire career, and I do medical education too. Everything from that to being a optometrist, a dentist, a podiatrist, a physical therapist are all different wonderful health professions. Psychology, you could be a behavioralist, you could be a nurse practitioner, you could be, did I mention acupuncturist? There's just a million, you could be an ultrasound tech. There's a million different ways to have a rewarding career in healthcare. And one of the things that UC Merced really excels in is helping you figure out what's right for you. Can I have the next slide, please? So in order to do that, the way that we get started is that we think about your pre-health career and your time in college as an opportunity to break things down into things, exploring different ideas like what's in healthcare, doing, having different experiences, and applying. I'm going to talk about each of them for just a second, but if you have questions, please put them in the Q&A and we will answer them at the end. So exploring is a really important part. As I mentioned, there's lots of different ways to be a healthcare professional. You may not know which one. So there's at UC Merced, we have a lot of pre-health groups that you can join, and we'll talk about some of those today. There's opportunities to be mentored by health professionals in lots of different fields. And you also need to spend some time reflecting and thinking. That's the first part of the journey. The next part of the journey is the sort of active part, is the doing part, right? So finding a major that works for you, taking classes, going out in the community and being in some healthcare settings, working on maybe community projects like health fairs, maybe getting involved in research, conceivably taking a gap year. Merced has the opportunities to help you in all of that. And then applying. That's the part about getting letters of recommendation, taking testing, practicing interview. We have a lot of experience in coaching students through the interviewing and application process. So we are here to support you through all pieces of that. Could I have the next slide, please? And so one of the things that makes UC Merced really, really unique in supporting a pre-health career, honestly, is the size of the campus. We have a much a greater number of opportunities because we just don't have as many students on campus as some of the super large schools. And that means that there's more individual attention for you. There's more opportunities for you to find your own pathway and to get attention, whether it's from an advisor or in a class or in a mentoring experience or something extracurricular. So some of the things that we think about are our pre-health workshops, the mentoring experiences, a lot of great student organizations. We're going to just say a few minutes about each one of those things, just to give you a slight taste. But again, we encourage you to come to campus and join us to see. Can I have the next slide, please? So I want to now turn it over to Dr. Maria Ramirez Loyola, who's a PhD and from UC Merced in her educational career to tell us a little bit more about some of the on-campus opportunities. Thanks.
Yes, thank you so much, Dr. Venner, and congratulations everybody on your interest at UC Merced. So one of the things that I think is really exciting, like Dr. Venner mentioned, is I actually completed my PhD here at UC Merced in health psychology. And one of the things I loved was how much support there was available, even for graduate students, right, to explore health-related careers that we were interested in. And so what I'm going to do today, I currently serve as a student affairs manager in the Department of Medical Education, is that I'm going to talk about various support systems that exist on campus, because you'll quickly really realize that it's not just one person and one department that's providing support. At UC Merced, we're really very intentional in making sure that students are supported depending on, what stage of their pre-health exploration related to health careers they might be in, right? So one of the newest resources that's available is actually meeting with our SJV Prime Plus Department of Medical Education Student Services Advisor. Her name is Heidi Guzman. She's actually part of my student affairs team in the Department of Medical Education. And Heidi is a great resource for students who might be interested in, learning, like where do I even start, right? So I'm interested in pre-health careers. What does that mean? Who do I connect with? Where do I go? I'm just, in my first year, first semester. You're probably not ready to apply, right? But what you probably are really interested in learning more about is what kind of support systems exist on campus, right? So one of the things that might be really helpful is to schedule a one-on-one advising appointment with Heidi and say, okay, it's my first semester. Where do I start? What do I need to know? How do I, make sure that I'm doing the kinds of things that might be needed so I have a really strong application for, insert health career here that you might be interested in by the end of your 4-year journey, right? And Heidi can really help provide some advice about that. It's also really daunting, to figure out who do you talk to aside from, pre-health advising or maybe your academic advisor. And Heidi can support students by saying, okay, you're really interested in getting hands-on community engagement experience. Go talk to this department. They can provide information on, based on where your experiences are right now, what kinds of things you might want to build on, and what kind of opportunities are coming up. And so Heidi is a great resource. Think of her really as the first stop for anybody who's interested in learning more about other pre-health resources that might be helpful. She's a great starting point to help you get connected so you don't feel like you're doing all of that by yourself. Next slide, please. Another thing that's really exciting and that I would be really excited about if I was in your shoes is that we're getting ready to launch a really collaborative pre-health CAT course site. And CAT course is just the site that we use at UC Merced for various classes. So students get really familiar with CAT courses because that's where they do their coursework, right? That's where they participate in classes. And so what we did is that one of our amazing faculty member in collaboration with various staff members, developed this collaborative pre-health site that's going to launch in fall for students at UC Merced. And it really kind of centralizes all of the information that you might be interested in learning and really organizes it in a very user-friendly kind of start here, pick your own adventure, depending on what you want to learn at that particular time, right? So let's say that you're really interested in learning more about, okay, what are the strong academic foundations that I need to make sure I'm going to be prepared for, medical school. So you might be wondering what classes do I need to take? Who do you need to talk to? And things like that. So you can start by exploring resources there. But maybe, in your second year, you're really getting ready to build on experiential learning. So that might be something that you explore in your second year, right? And so this CAT course site will be great because it's centralizing all of the information in a way that you can constantly keep coming back and learning more so you don't feel like you have to know everything all at once. Next slide, please. So let's say that, okay, you've explored and you're getting ready to really plan, right? To think about, am I interested in medical school? Am I interested in pharmacy resources, nursing, or other things like that? Then you might want to dive deeper into those particular resources that we have at UC Merced just for those areas. And so this is just an example of some of the things that we're putting together now to really help students explore, right? Like depending on what it is that you're interested in doing, there's resources and information centralized here. And so you can go through, and maybe it's in your pajamas at 2 in the morning, right? That you want to learn some resources because you just learned about an amazing career opportunity. You can click on the tabs that we have here to learn more about what's available at UC Merced, and what kind of things you might want to know as you explore a little bit deeper. Next slide, please. Finally, we always get a lot of questions about, what kind of things do I need to know when I'm getting ready to apply, right? And so some of the great things that that are being centralized right now is, things like MCAT prep, interview prep, personal statements, how do you ask for letters of recommendation? And part of the information that we're going to have here is various resources on campus, like the Student Career Center that you might want to connect with, academic advising, the Undergrad Research Center, and other campus resources all in one space so that you can identify what might be helpful for you depending on what you're interested in learning more about when you're getting ready to apply. And so this was just a preview, hot off the press, to really highlight, I think, that providing pre-health resources at UC Merced is something that we're very, very collaborative about. And there's always something that's there to help support you, so you don't feel like you're having to do that on your own. And so hopefully the take-home message is there's actually a lot of information, a lot of student support systems that exist, whether you're exploring, whether you're getting ready to plan, or you're applying to health-related careers. And we're happy to guide you at every stage of that and point you to wonderful, warm, friendly campus partners that are also available to support you as well. Next slide. So, you're probably saying like, okay, that's great. Like, okay, talking to staff, is wonderful and all, but like, I want to hear from peers, right? I want to hear from other students who are UC Merced students who are also on similar trajectories or are also very interested in health-related careers. And I have great news for you. We have so many wonderful, thriving, and really fun clubs and orgs at UC Merced, specifically focused on pre-health careers. And this is just a snapshot of some of those clubs. This isn't a comprehensive list by any means, but I'm really just highlighting, right, that regardless of what exactly your health career interests, there is probably already a club at UC Merced for students who are also like-minded and are interested. And that's really important because navigating, career exploration in health-related areas can be scary. So building that sense of support and that community with other students is really important so that you can say like, okay, I ran into this type of issue right now. How did you navigate that at UC Merced? Who did you go talk to? And now you'd be hearing from, peers in maybe years that ahead of you or peers in similar years as you, which can be really impactful. Our clubs and orgs at UC Merced, especially our pre-health clubs and orgs are very, very active with hands-on experiences. And so VitaVolunteer.org is just an example of a type of event that, clubs and orgs put on or participate in. Another thing to really note too is, let's say you don't see a club or org in pre-health related areas that you're interested in, you also have the opportunity to work with our Office of Student Life and Involvement to maybe create one, right? So if you see a gap, that's something that is really great about UC Merced, is that if you see a gap, our campus is really, really open to hearing, what possibilities you might bring, and then working with you to guide you through necessary steps to maybe launch that club and org to support other students who might be interested in something like that. Next slide, please. So in addition to those, formal student support systems that exist, where you have staff like myself and my wonderful team and all the other wonderful staff members at UC Merced and your peers, right, in clubs and orgs, we also offer a variety of different health-related events that we support student participation in, including, the pre-health conference at UC Davis, which is not super far from here, or the Reaching Out to Aspiring Doctors or Road Conference that happens at UCS at Fresno, which is also like an hour away. And so this is just really a snapshot to highlight that, depending on what you're interested in engaging in, there's probably a student support system at UC Merced that's here to meet your needs. And so you don't have to worry about memorizing all of this or, taking screenshots or anything like that, because you can talk to to Heidi, who I mentioned earlier, or to your academic advisor or any other person that you're already connecting with and say, hey, I'm really interested in learning more about, health-related events. Do you know who I can connect with? And we're really great about, facilitating those warm hand-off kind of conversations, because it can be intimidating sometimes, right, to reach out on your own when you don't know anybody, especially as your first year. And so, again, you're not here by yourself. We're here to support you at every step of the journey. Next slide, please. And so, in addition to sort of the staff, peers, and other conferences that I've already mentioned, there's also a great support system that our faculty provide. And so, some of the things that you might be able to take advantage of that would be really helpful is, attending tutoring or office hours. Like Dr. Venner mentioned earlier, one of the great things about UC Merced is because we have a smaller campus, you can really connect with your faculty in a way that is a lot harder in other UCs. And I completed my bachelor's at UC Riverside. So let me tell you, it was a lot easier to connect with faculty here at UC Merced than even UC Riverside, where I was an undergraduate student, just because there's a lot more opportunities to connect with them here. Um, Next slide, please. And finally, before I turn it over to Dr. Venner, I just want to highlight that one of the resources that I mentioned early on, kind of multiple times that you might have caught, is your major academic advising. And so for all first year students, you all are going to be advised by the Bobcat Advising Center. And they're a great resource. So they're the ones that you talk to for class-related questions, but you should be registering in. So if you're wondering, hey, I want to go into medical school, what kind of classes do I need to take that are aligned with my major requirements? They're the folks to talk to. We also work really, really closely with them. And so we're often referring students to each other. And so if you're not sure where to start, they're a great first stop to point you to that next resource. And they're really, really friendly. And next slide, please. And now I'll turn it back over to Dr. Venner.
Thank you. Thank you, Maria. That was fantastic information. I really encourage people to ask questions. I'm going to just talk a little bit about pre-health pathways, and what that means for you as a student who's just starting out. And again, why Merced is a great place to do this. So first of all, really important to understand that for folks who are thinking about a pre-health pathway, you may not know just exactly which health career you're interested in yet. The Merced is great at offering majors that really align with multiple pre-health careers. So the Bobcat advisors are really set up to help you in that way. So you don't have to make a commitment like right this moment, this is what I'm going to do as my career. You can start your major and still have opportunities to think about it. For folks who are particularly thinking about medical school, there is no singular pre-med major, right? You could actually major in lots of different things that will get you to medical school. Medical school is all about, or applying to medical school is about having taken a core of required classes. We can help you walk through that. Our advisors are really good on helping you look at your placement test exams and figure out what's the best pathway for me, what would most align with my interests that would prepare me for medical school. Most commonly, our students who are pre-med are going to major in biological sciences of some sort. We'll talk about that. Or in public health. We certainly have folks who go other routes like bioengineering. I will just be honest with all of you. I will tell you I was an English major in college, and you know what? I love it. It's the greatest major ever for going to medical school and being a doctor because it taught me great communication skills. I use them every day of my life when I see patients, including today. So I'm putting in a plug for English, but I do realize that's not the most common major. We're going to talk a little bit more about some of the more common paths to medical school. And again, we have really strong tutoring programs and pre-health advising and support to get you where you need to be, including research and internships and clinical experiences. So it all fits together at Merced. Can I have the next slide, please? So part of the background of this that I would be remiss if I did not mention is that it's hard to make all these decisions on your own. And so we have a really unique and fabulous mentoring program at UC Merced. There's actually many different types of mentors that you can have, but one very unique feature of UC Merced is that we have a class that you can enroll in mostly first year, although really you can enroll in all 4 years if you want to. It's called Intro to Medical Learning. I designed it when I started at UC Merced as a way to help get students get more real world exposure to health professions careers. And so as part of this class, you learn about different key concepts in healthcare, kind of start with an overview, and then you dive into different pieces. But also as part of this, you will be assigned with a small group of students, 4 groups total, to a healthcare mentor that you'll meet with virtually over the entire year. So if you say like, oh, how could I know what to go into in healthcare? I don't know anyone in healthcare. That's like often a concern for students. I can promise you that when you sign up for this class, you will know someone in healthcare. You will have a close mentor and friend in healthcare, and they will help you sort of talk through the issues and think things through and just give you a healthcare perspective on it. There's also time for other types of mentoring. We're very closely connected now with UCSF Fresno, and I just put one of my favorite UCSF Fresno programs on there because it's run by med students, and I work with the med students really closely. That is a more peer-to-peer mentoring program for students specifically interested in medicine, although again, we welcome students interested in considering all careers. Can I have the next slide, please? Um, and so in addition to mentoring, now we've talked about all the student support pieces. You're probably wondering like, well, what do I major in? What about the actual classes? Again, there is no singular pre-med major, but there's a lot of different popular majors for pre-med students or pre-health, and that's because they tend to have the same core of pre-health classes embedded, like biology, chemistry, often organic chemistry, physics. So tends to be embedded in this. So this is what we have a slide for here is the biological sciences pathway. You can either get a Bachelor of Sciences, and then there's 5 different emphasis tracks, which you can see here: human biology, developmental biology, molecular and cell biology, microbiology and immunology, and ecology and evolutionary biology. Or you could take a slightly different track and get a Bachelor of Arts, a BA in biological sciences, and pick your own emphasis. And I think we have some students here on our panel when we answer questions who will be able to tell you a little bit about their experiences. All of these tracks are fantastic, get a lot of personal attention, and I think a really great preparation for any health career. Could I have the next slide? And with that, I want to pass it over to Dr. Heather Bortfeld to tell us more about the neurosciences. Thanks.
Thanks, Dr. Venner. Hi, I'm Heather Bortfeld, and I am a psychologist by training, but I am also the director of the Center for Interdisciplinary Neuroscience, and I am really excited to talk about this new degree that the center has overseen getting started here at UC Merced. It's neuroscience. We have both a BS and a BA. Neuroscience is an interdisciplinary field, and I've always said that I really think the most exciting science happens at the joints, and by that I mean where things really interact. In terms of different fields: biology, psychology, cognitive science, public health, lots of different overlap in these domains. And engineering, I should say, as well, is a big topic. So what we've done is we've created a BS with 3 different possible emphasis tracks, or you can just do the basic BS in neuroscience. If you want to get more in depth with molecular systems and cellular neuroscience, you can basically pick courses that go a little bit deeper into that, in addition to the core pre-med lineup of classes that Dr. Venner just mentioned. We have another emphasis line that is computational, perceptual, and cognitive neuroscience. This again incorporates pre-med, basic biochem, some physics, and then goes into brain imaging, computational modeling, so the sorts of things that cognitive scientists and cognitive psychologists pursue. And then the third emphasis area is neuroscience of human health and development. And we have a big health psychology group here at UC Merced. We have a big public health group. And what we've done with this particular emphasis is get those core pre-med courses and then layer on the kinds of courses that'll really get somebody focused on the big picture of human health and how systems interact, including the medical system, all the way down to the individual. So those are the three emphasis areas within the BS. We also have a BA that's designed for students who want to be able to layer in some ideas about neuroscience without doing everything involved in a pre-med lineup. It's much lighter on the math, but still involves quite a bit of science. And so that's also an option. And so I just want to say that, the BS has a very strong pre-med foundation with different technical specializations layered on depending on what you want to do. The BA has broader application across fields. And in terms of careers, I'm happy to answer questions about that during the Q&A, but those kind of set you up for different career trajectories. But for now, I'm going to hand it off over to Dr. Ramirez from Public Health, who's going to talk about their pathway.
Good evening. Congratulations to all of you for being admitted to UC Merced. My name is Professor Ramirez, and I am the Director of Undergraduate Studies for the Public Health major. And I guess what I would like to start by saying is that when we think about, and everyone here is interested in improving human health, but when we think about what has most improved human health over the last couple of centuries and really contributed to the fact that we all live so much longer than our ancestors did, we tend to think about medicine. We tend to think about the new treatments and the new technologies. But if you step back, where we have really seen the biggest gains in life expectancy are from public health efforts. So I'm talking about vaccination, I'm talking about sanitation and clean water and policies that shape the environments that we live in often in ways that we don't even notice. So public health is a way to get into medical professions starting from a different place. So instead of asking, how do we treat this disease, we ask, why is this disease happening in the first place? And why is it happening more to some groups than to others? And we also ask, what would it take to prevent it? And that's really kind of shift that matters for medicine, because more and more what clinicians are seeing in the clinics is downstream of something else. So it's, really bad asthma cases that are due to the air pollution, really serious cases of chronic diseases that have been made more serious because people lack access to healthcare that could help treat early on. Patterns of behavior that are the result of marketing and advertising and pushing of unhealthy products and things like that. So if you can see those patterns, you end up practicing differently. So what we've built with the BS in public health with a pre-med emphasis is a pathway that helps to keep the full pre-med science training. So all of those courses that Dr. Venner mentioned as being required for medical school, but adds a population level lens. So you still take biology, chemistry, and physics. Alongside that, you're learning how to analyze disease patterns using epidemiology and biostatistics. You're learning how to connect biological processes to patterns in populations and how health systems and policies shape what happens to patients before they arrive in clinical settings. And our BS in public health is really built for that reality. So the result is I'll be a little crass and say it's a little strategic also to major in public health because it does, I think, give you an edge that most applicants to medical school don't have, that population lens. That's kind of, that's a crass way of saying it, but it also, is very real. It's something that I believe is quite important for physicians who are going to treat us in the future. So, and, going to practice medicine with this broader analytic lens that links individual care to population health. Okay. And then if I can have the next slide. So in addition to talking about my program, I get to share with you what you probably already know, that UC Merced is #1 in the UC system for undergraduate participation in research. I saw questions coming in already about students wanting to get engaged in research, and I can tell you that you can get involved from day one. We strongly encourage our undergraduate students to get involved. 3/4 of our students do participate in research, and you can do all kinds of things. I can tell you, for example, in my department, faculty are working with undergraduates to analyze asthma-related emergency department visit data to identify patterns across neighborhoods. They're going out and they're measuring air pollution and wildfire smoke and collecting data on how those particularly high days are affecting lung function. They're using statistical models to predict changes in airborne pollution exposure and how that might reduce asthma rates. They're working with data sets that faculty have created on looking at state and local level policies regarding who is allowed to access certain kinds of health insurance, and looking at how that contributes to patterns of health and disease. But there, you have all kinds of opportunities. It's a matter of working with your advisor and taking advantage of the various resources that exist on campus that can help you get connected. I will also say that most of our faculty are really open to students coming and showing an interest in joining their research teams. And that's not something that's weird or unusual. We have graduate students and we have undergraduate students who get really an unusually high level of exposure and experience in the kind of research. It's not unusual for undergraduate students to publish journal articles with their faculty members. That they've been involved in research for a couple of years, and they help from the beginning data collection to data analysis to writing up. And that's enormously, that's a great way of learning. It's also, again, a little bit strategic to help you achieve your goals of getting to medical school or graduate school. Next slide, please. This slide just showcases a few of the formal organizations that can help you make those connections to find faculty to do research with. So the Health Sciences Research Institute is one of the centers on campus that is where many faculty run a lot of their research that's funded by the National Institutes of Health, for example. They have a lot of connections with faculty who do any kind of health-related research. The Sierra Nevada Research Institute is a sister organization to the HSRI, and they have a lot of folks who are doing research on ecology. The Undergraduate Research Opportunity Center, what we call UROC, is they often have funding for summer research opportunities. They host a variety of trainings and opportunities for students to showcase the research that they have worked on. And then you heard from Dr. Bortfeld about the Center for Interdisciplinary Neuroscience. And I think we've come to the end. I'll pass this back to Scott to kick off the question and answer.
Great. Thank you so much, Dr. Ramirez. We will jump right into our questions that have been posted here. So for our panelists and our students, before I get to those questions, Kim Waji, could you guys introduce yourself?
Yeah. Hello, my name is Kimberly Carrillo. I'm a second year human biology major at UC Merced. I'm a student ambassador. I'm ready to answer any questions y'all have.
Hi, my name's Wachia. I'm a third year human biology student with a minor in psych. Aside from being a student ambassador where I help prospective and admitted students, I'm also a mentor for the biology department. So I work with a lot of freshmen and sophomore by helping them pick like what classes they can choose, as well as guiding them in how to succeed in those courses. And then aside from that, I also do a lot of volunteering off campus, which I've seen a lot of questions about that. So I'm ready to answer.
Okay, thank you so much. So our first question, does UC Merced have any summer programs for high school students who are interested in the medical field?
As of
Like,
right, oh, go ahead.
so I was going to say we have um, courses. So students who have already been admitted and would like to get an early start on required coursework, you can take our summer classes, and I would encourage you to sign up like tonight or soon so that we can make sure that we make the minimum enrollment. But we're offering, for example, Introduction to Public Health and Global and International Health, which are two required courses. That is a really good way to go ahead and get your required courses out of the way and get excited about being on campus, though they're virtual classes, but still, already some of the classes. We also, I don't know if folks are familiar with the Cosmos program, which is a huge initiative of the University of California. This is our first year of hosting a Cosmos UC Merced. And it's too late to apply for this year, but I think that next year we will be having a pre-health, public health Cosmos cluster. If any of you are early sophomores or juniors.
Okay. Um, Dr. Benner, this might be a question for you. Is UC Merced going to form a medical school soon in the future?
How long do you want to talk about this? We could do an entire webinar on just this topic. The answer is it is absolutely the long-term goal to have a medical school in the Central Valley. When UC Merced was started in 2005, it was always the plan to start a med school here. One thing led to another. It's taken a little bit longer. Right now, what UC Merced is doing is we are working in partnership with UCSF. So we are a regional medical campus of UCSF School of Medicine. That's actually where I've had the majority of my career until I came here, and I work at both. And we're also working in partnership with UCSF Fresno, which is also a regional medical campus of UC San Francisco School of Medicine. So the long term, as in like way down the line, long term is to have an independent med school. In the meantime, we are working on developing just training for the doctors for the Valley, for doctors who are, quote, from the Valley and for the Valley to ensure a supply of physicians for the Valley. And that's the partnership between UC Merced, UCSF Fresno as regional campuses, working in conjunction and under the LCME accreditation of UCSF School of Medicine. So get back to me in a decade and we'll talk more. Thanks.
She might be retired by that time, but um, does UCM offer a Bachelor of Science in Nursing program? At this time, we do not. There's always discussions about adding new programs, but this particular program, it is not on in the near future.
That goes on our list of aspirational programs,
Right, yeah.
along with an optometry school. These are all on our wish list, but no immediate plans. But certainly the Valley and just the healthcare system in California needs all those future healthcare professionals. We will help work with you to try to get you to the places where you can pursue that training and then hopefully go practice in a community that really needs your care. Thanks.
What happens if you are a pre-med student but didn't apply to the BSMD pathway? Can you still apply in your first or second year, or is it too late?
So I saw there was several questions like this. I think I'm going to answer them all together. The BS to MD program is a program that you needed to apply to when you were a senior applying to high school. So if you're already accepted to UC Merced, then that's behind you, so you can't apply at this point. However, what I would strongly, strongly urge you to do is come to UC Merced, do a pre-med experience of some sort in a major of your choice, and apply to, there's a program at UCSF School of Medicine called SJV Prime, San Joaquin Valley Prime Program in Medical Education, that you can apply to as part of UCSF that has med school experiences in the Valley, and those students will be coming to, I mentioned, us as a new regional campus at UC Merced and at UCSF Fresno. So I would urge you to apply to that program, or honestly, to lots of other really fantastic UC community-based programs that are designed to help create a supply of doctors for the communities that need them.
What structured global health or study abroad programs are available for pre-med students, and how accessible are they? Any of our students?
Oh,
Go ahead.
I can answer this. So there is Atlantis, and that one you will probably get a lot of emails about, as well as seeing flyers for it around campus. Atlantis gives you the opportunity to go and shadow doctors, as well as like watch them in the day of their lives, like throughout all of Europe, and I believe in Spain as well, but I think that's also in Europe. And then we do have like study abroad programs aside from pre-medicine. So our study abroad programs, if you see one, they will have them for different majors. So students will go and study abroad just to take some classes overseas while still completing their degree here at UC Merced.
Yeah. And if I can add, one great way to stay kind of hear about all those opportunities as they emerge when you're a current student is to go visit the pre-health website. We have a listserv that you can sign up for. And part of what we do is that as these opportunities become available and our faculty hear about it, our staff hear about it, or wonderful students who are participating, they share that with us. And then we send that out to all of the students at UC Merced who are interested, that we don't have to worry about like searching up things, or maybe you didn't participate this year, but next year you do want to participate. And so that's a great way to keep up to date with all these wonderful experiences that are available throughout your time at UC Merced without necessarily taking a lot of work on your end to find those.
And I'm just going to chime in that study abroad can be done through courses, and we have exceptional study abroad opportunities. And there are also faculty who do international and global health research and who take students with them. So this is another plug for getting involved with research and looking around with faculty who do international and global health research.
Which EMS agencies most commonly transport patients to Mercy Medical Center? Do UCM students typically work for them?
I can answer this question.
Oh,
I'm currently getting my clinical certification for EMS. So I did a lot of research about this, but like one of the conferences that Maria had brought up, you will see agencies come and like suggest it to students as something they can do while they're in school. And UC Extension also provides the support to go and get your certification. So that's where I was able to do one of mine. And basically, you can take classes like you normally would. A lot of it is online, and they do hybrid for you to go and get that on-hand experience. In the past, Mercy Hospital has used, I believe it's called Briggs, but they had switched to a new one in the start of the year. But that is typically the one that you will go and work at your externship.
Yeah,
fantastic.
and if I
Thank you.
can add, this is a great question to bring to the Student Career Center really early. So all of our students have a special career advisor that's assigned to them based on their major. And that's a great question to come with in your first semester. Let them know that you're interested in knowing these kind of services. They'll then work with you to plan out like what things you might want to do in your first semester, second semester, third semester, and things like that, so that you're building on experiences that bridge together your classes and the hands-on experience that you're interested in, if that's like, for instance, your goal. And then they always have really large student career fairs that happen every semester where they bring a lot of local and external hiring agencies where you can ask these types of questions to, saying, I'm interested, what kind of volunteer opportunities do you have? And, what's the possibility of building that into a full-time role? And so our student career office is a great resource. And they're also a free resource that you can use if you're alumni. And that's something unique to UC Merced. You can still meet with your career specialist here, virtually or in person. And that's not something that, other UCs necessarily have the capacity for because they're a lot larger. And so that's something that is unique to UC Merced.
What local opportunities for clinical experience, physician shadowing, and volunteering are available in Merced or nearby?
I'll jump in about, depending on the kind of clinical experience you're describing, we have in the psychology program an internship with the Merced County Office of Education, their Behavioral Health and Recovery Services group. And so this is a mentored internship where there's a clinical faculty member on campus. You have a class with that person, and then you have hours off campus with designated groups within behavioral health recovery services. So a lot of this is much more social work and counseling sort of oriented, but that is a good starting point if you're interested in going in that direction. And there are various other internship programs that UC Merced supports across campus.
How do we register for the Intro to Medical Learning course? Will this be something that we will take during our first year?
Yeah, so I can start and then Dr. Vedder, please feel free to add anything I might miss. So something that's really exciting for us to share is that starting this fall, the Intro to Learning courses is going to be offered every semester for all 4 years. And there's going to be two different sections. So there's going to be a lower division section that you can take at any point in your first and second years. And so it's offered every semester. So please don't feel like you're going to miss out if you have a lot of major classes that you need to do in your first year, first semester. Like there's going to be multiple opportunities for you to take that lower division class. Then once you've taken that lower division class, you're able to enroll in the upper division Intro to Medical Learning pre-health class. That's also going to be available anytime in your third or fourth year, where they'll build on that foundational knowledge that you learn at the beginning. And so starting this fall, those classes, both of them, are going to be offered every semester for our students. So you have a multitude of opportunities to connect and learn that material. And that way you don't feel like, you have to pick or choose, like, do I take this class or this class because it's only offered once? That's not a problem. And so, yeah, that's something that is really exciting for our students.
Will I be able to work with UCSF physicians even if I'm not in the SJV Prime Plus pathway program?
Oh, it looks like one of our students wants to answer that question, so I'm going to let you.
Yeah, you can. I always tell this to the students that ask me these questions, and I say that closed mouths don't get fed. And UCSF is more than willing to like accommodate for that, even if you're not in the program, but you will do it like externally. So the SJV Prime Plus program usually sets students up with their own physician, so the students don't have to do them that like themselves, but you still do have the chance to go and shadow them as long as you fill out that external applications on your own. And then this kind of backpacks off the previous question that was asked. There are other opportunities to shadow like clinicians aside from UCSF. So in Fresno, we do have a Kaiser Hospital, and you're allowed to shadow them as well as the Children's Community Hospital in Fresno as well. The way that one works is you will submit your application and then reach out to your own physician, and they're really nice. A couple got back to me recently, so they're more than willing to let you shadow.
I think we
I'd
found a
also
replacement for Dr. Venner.
Sorry, I'd also like to just add on that a little bit. There are also other opportunities with with not just clinicals, but also in research. There's a lot of research being done here at UC Merced, which they've talked about earlier. Our Undergraduate Research Opportunity Center has a lot of programs, and we do have some in biology or any pre-health major as well, not just biology. And you can also apply for these. The application opens in the fall, and these programs typically run in the summer, but there are also some that, or they can direct you to some that are in the fall and spring, as well as just getting to talk to your professors from any of your classes. Most of our professors on campus do have their own research labs going on, so it's pretty easy to just get to know them, go to their office hours and talk to them a little bit. And then sometimes they'll end up inviting you to their project, as well as just emailing any open lab that you see that needs some help and asking if you can join. A lot of my friends have gotten research opportunities just by emailing professors. And then also, me personally, I also went through UC Merced Extension, which is now called the PACE program. And I received my medical scribe certificate, which is just somebody who transcribes the patient's visit. So anything the patient tells the doctor, they transcribe it on their notes. I've also gotten interviews for this position at one of the surgery clinics around Merced. So it is possible. You just have to go looking for it.
Thank you. So been admitted as a first year, when can we connect with our academic advisors to talk about and register for classes? I'll just mention that we do pre-enroll all of our first year students into their first semester of courses, and we do that based on the major that you have selected. So if you're going to be a public health major, we've talked with the public health department to find out what courses you need to be set up for success for future terms, and we enroll you in those courses. So you're guaranteed to get into the classes that you need in your first semester to set you up for success.
Mhm. Yeah, no, thanks so much. And then if I can add, so once you submit your intent to register, we encourage you to claim your UC Merced email as soon as possible. The Bobcat Advising Center, which I mentioned earlier, will be sending out emails to the UC Merced email for all of our students who have accepted their offer in late May and early June, letting them know what next steps are and how they can start connecting with you. As soon as like early June, they'll lay out, how they might have virtual appointments, in-person appointments, or things like that. So as you're going through what's called first year Smart Start, which is what Scott just described, if you have questions or, maybe there's like another class that, your advisor's like, okay, this is great, but this class that is required for your major might only be offered this semester. So why don't we talk about, maybe switching that class for this other class that's offered every semester? And those are the kinds of questions that they'll work with you in the summer to make sure that before the semester starts in fall, you're all ready to go. You know exactly what you need to do to make sure that you're on track for that four-year graduation. And so those emails will go out to your UC Merced email again in late May/early June. So make sure that you claim your UC Merced account as soon as you submit your intent to register. And then check that regularly. That's where we'll be sending you all these wonderful, exciting opportunities and really key deadlines in the future.
Can you do a minor in psychology with a major in neuroscience?
Yes, you can. Yes, that's a great mix. Bio and a psych minor, like one the student mentioned here, is a great mix. Being a doctor is all about dealing with people, and that involves a lot of psychology. So I'm a big advocate for minors. We also have a minor in neuro. You can do things the other way. So it's kind of a mix and match depending on the degree of intensity you want in any particular domain.
Thank you. Do we have a percentage of applicants from Merced that were accepted to an MD or DO program?
No, honestly, we don't. And I'm not sure that any university really does. And the reason for that is a really important one to understand, which is that at this point, at this day and age, an extremely high percentage of students who are successfully matriculating to either MD or DO programs do so after a gap year. The reason for that is that it really disadvantages students to take the MCAT before they have finished taking the classes. And a lot of students don't finish taking those in any university until fourth year. And or people just want more time to study for the MCAT. And some people just want to use that extra year, honestly, to relax because it turns out med school is really hard. And probably one of the best reasons of all, it's also a great opportunity to get a job and some relevant experience and make sure that this is really what you want to do. So for all of those reasons, an extremely high percentage of students who successfully apply to med schools, DO or MD, end up taking a gap year or sometimes two before they apply. And for that reason, it makes it really hard to track because the students aren't just applying like, oh, it's the end of my senior year at UC Merced, I'm going to know where I'm going to go. This is true at any university. Students' most successful attempt is often after a gap year. So I don't know that there's a percentage, but we've done relatively um, uh, a great job of preparing our students for success, and we feel very confident that after their gap year, they're ready to successfully apply. And from what we're hearing back from students, it's really worked well for them. Great question.
For our students, do you find it difficult to balance volunteering in classes?
No, I volunteer on the weekends, and a lot of places are more than willing to let you volunteer on the weekends. I In the beginning, I was trying to volunteer like 8 to 10 hours a week, and that in itself was difficult for me just because of my course load and the fact that I do work. But of course, it's ultimately up to the students. If you feel like you can manage your course load and still have many extra hours to go and volunteer, I suggest do it. But one thing about volunteering and in my trials and errors, I will always say try volunteering with something that you're passionate in. You don't want to spend any time doing anything that you're not going to be able to explain to medical schools about. I volunteered once in the soup kitchen, and I realized afterwards, I was like, okay, I can keep doing that, and it was fine. But then I volunteered in the emergency room, and because I do want to go into emergency medicine in the future, I realized I was much more passionate about it, and I was much more willing to give up my time to go to the emergency room every weekend because I did really enjoy being there. So ultimately, it is about you, and if you feel like you can designate 4 hours a week to go and volunteer, I recommend doing it.
All right. What medical research activities are planned in the new medical building?
So the new medical building, which is my normal Zoom backdrop, includes, it's a really collaborative building. It's a beautiful space. It's not quite open yet, but when it is, I encourage everyone to come see it. It's built around a courtyard. It has medical education. So the medical education piece includes a space for community grand rounds, anatomy lab, patient simulation, smart classrooms, offices, all that stuff. There's also an enormous amount of space for psychology, including research. There's a fantastic public health space. There's the HSRI, the Health Sciences Research Institute. And then there's the mysterious fourth floor, which is built as a shell. We don't know what's going to end up there. I'm excited to find out. And I don't know if anyone else wants to add on to this. And there's a courtyard and a cafe. It'll be fun.
Yeah, we're excited to move in. The psychology faculty and Dr. Ramirez's group in public health, we're all moving in next fall. And the idea is it'll help get people closer together and together with the pre-med folks to start training grants and other kinds of collaborations.
We're going to have a demonstration kitchen for one of my colleagues who's a registered dietitian and does community nutrition programs. So that's really exciting too.
We're going to go ahead and conclude with this final question. How would you recommend a pre-med student to structure their 4 years in undergrad? Like, should we start to get hours in freshman year, or should we focus on grades? What's the best structure?
I'm going to try to answer this question, then turn it over to one of the students, if that's okay.
Go ahead.
From my perspective, and I say this both as an educator, a parent, and a former student, freshman year is a really big, or first year is a really big transition. And so honestly, we've talked about a lot of resources here. I would really focus on getting yourself established, get yourself rooted in your first year, figure out your major. I would focus on your classes, finding them for starters, and talking to your professors and developing some good study habits, figuring out what works well for you. I would really focus academically on what do I need to do to learn well first. A lot of the other stuff, and our students are so accomplished that on our panel they're talking about all these great things they're doing, like volunteering and shadowing, experiential learning, research. Those are great, but those are, you got to get the academics set up first, as well as like where am I going to live and who are my professors and who are my friends. And then I would reach out towards uh, thinking about experiential learning, which means working in a clinical setting, volunteering, and then finding, once you know what you're passionate about, and I really agree with your comments about find out what you're passionate about, then the volunteering and then the research so that you can move in the right direction and really set yourself up for success by building a strong foundation first. And I'm very curious to hear from the really insightful students. Thanks, students, for being part of this.
I'm gonna agree. My freshman year, I'm gonna be very honest, I focused on my classes. I wanted to make sure that freshman year, you're gonna be doing your intro to bio, your intro to chem, one of your first math classes, some of your first like physical elective classes. This is your first time being a college student. So I recommend spending that time giving yourself grace to do those things and to get comfortable here. And then everything will surely follow after. I know, especially to the freshmen, I will say you're gonna want that experience in the lab, whether it's Bio 11 or like one of your first chem classes, just so you know what the inside of the labs look like. And then surely after, once you get to know more professors, once you get to know about Merced more and the school more, then all of those extracurricular stuff will come after.
Yeah, and I'll just jump in. I think students some students get a bit too focused on all the extracurricular, and it's really, doing well in those core classes, developing study habits, and doing well in the classes leads you to meet faculty who want you to work in their labs, and that's where the research really kicks off. And the earlier the better, but that comes with doing well in courses. Yeah.
Let's see, Kim, do you have a final word here?
Oh, well, yeah, I was just gonna agree with what everyone said. I mean, a lot of times, like they said, freshman year is a transition from your previous institution and from your previous life. It is a really big change, although it might not seem like it. Especially like for me, I moved 4 hours away from home completely by myself. I didn't know no one here. So really making sure that you have set your place here at UC Merced, that you've made a community as in friends or professors or supporters, whoever here at UC Merced who can help you get through your first year is really important, because once second year, third year, fourth year comes around, you're in upper division classes now, which also gets harder. So making sure that you're able to handle all of your coursework and then look for any opportunities that are available here at UC Merced, because there's hundreds of opportunities here. So you will 100% find something that will help you in your journey. But it is most important that you focus on school because that's what you're here to do.
Thank you so much, Kimberly. And thank you everyone for your time this evening. Also, thank you to the panelists for their time. We're going to download the questions and see if we can get some additional answers posted out on our website. And I'm sure the faculty would be available via email should you have follow-up questions that you wanted to check. Have a great evening, and thank you for joining us this evening. Bye, everybody.